Hello, and welcome to our webinar today entitled Where is the Church on Global Health? A briefing on the America First Global Health Strategy. My name is Lanre Williams Ayedum. I'm the Senior Vice President for International Programs at World Relief, and it is my distinct honor to host this panel today. As a public health professional, it's not every day that I get to be in the same virtual room with the heroes of my discipline, so I'm excited to be here and to learn alongside all of you. You might remember that World Relief hosted a similar panel last year where we discussed the effects of the changing U.S. foreign assistance landscape in communities around the world. A year after those devastating foreign assistance cuts have been implemented, this panel is an opportunity for us to get an update. We'll begin with reflections of previous U.S. administration's leadership in global health, dating back to President George W. Bush, including his legacies of the President's Emergency Plan for AIDS Relief, PEPFAR, the Multilateral Global Fund to Fight AIDS, Tuberculosis, and Malaria, as well as his President's Malaria Initiative. What worked? What could have been tweaked? What do we want to see continue forward in our new global health agenda? And then you'll hear from a more granular level. What have we seen work in community-based public health? What fears do we have looking ahead? And what are some positive changes that we see on the horizon? We'll reflect together on the leadership role of the church in global health priorities over the last 25 years and talk about where we see that going. And finally, you'll learn about the America First Global Health Strategy. What does it purport to do? And what advantages and potential limitations do we foresee moving forward, particularly this year? As a reminder for all of you, throughout this discussion, you will have access to the Q&A function. Please use it. We want to hear from you, and we will have time to take audience questions after the panel discussion. So now allow me to introduce our speakers for today, though they likely need no introduction. Again, these are heroes that have championed global health over 25 years and more, and who are still advocating to see preventable, treatable diseases eradicated as epidemics. Today, our moderator will be Jenny Dyer. Jenny Eaton Dyer, PhD, is the founder of the 2030 Collaborative. She also directs the Faith-Based Coalition for the Global Fund to Fight AIDS, TB, and Malaria in partnership with Friends of the Global Fight. Jenny has taught in the Department of Health Policy at Vanderbilt School of Medicine, as well as at Vanderbilt School of Divinity. She formerly served as the executive director to Senator Dr. Bill Fritz's humanitarian organization, Hope Through Healing Hands, in Nashville, Tennessee. Prior to that, she served as the National Faith Outreach Director for the Data Foundation and the One Campaign, Bono's organization. Jenny has written numerous academic articles and opinion pieces on the intersection of religion and global health. She lives in Franklin, Tennessee, with her husband and 2 boys. Our notable panelists include Senator William H. Frist, MD. Senator Frist is a heart and lung transplant surgeon and former United States Senate Majority Leader representing Tennessee in the U.S. Senate from 1995 to 2007. His leadership was instrumental in the passage of the historic PEPFAR legislation that provided life-saving HIV treatment globally to 26 million people. Today, he serves as the chair of the global board of the National Conservancy, the largest conservation organization in the world. Senator Frist is actively involved in humanitarian and philanthropic communities, including founding and chairing the Community Collaborative Nashville Health, SCORE, the Tennessee State Collaborative on Reforming Education, and the global health nonprofit Hope Through Healing Hands. He also co-chairs the National Academy of Medicine's Climate Collaboration and serves on the board of Friends of the Global Fight Against AIDS, Tuberculosis, and Malaria. Kay Warren is an author, speaker, and mental health advocate who founded Hope for Brighter Tomorrows in 2024 to expand her ministry to hurting parents and to encourage churches to care well for individuals and families affected by mental illness. A passionate voice for mental health awareness and suicide prevention, Kay previously established the Hope for Mental Health community at Saddleback Church, which she co-founded with her husband, Rick. Through her advocacy, writing, and compassionate leadership, Kay continues to bring hope and healing to families and faith communities around the world. Our next panelist is the Honorable Mark Dybel, MD. He's a professor in the Department of Medicine at Georgetown University Medical Center, where he serves as the co-founder and chief strategy officer for the Center for Global Health Practice and Impact. He's also chair of the board of Purpose Africa. Ambassador Dybel has worked on HIV and public health for more than 25 years as a clinician, scientist, teacher, and administrator. He was a principal architect of and ultimately led PEPFAR with the rank of ambassador at the level of an assistant secretary of state. More recently, he served as the executive director for the Global Fund to fight AIDS, TB, and malaria. He's written extensively in scientific and policy literature and has received several honorary degrees and awards and is member of the National Academy of Medicine. Myal Greene is the president and CEO of World Relief. Prior to this role, Myal served with World Relief for 14 years. While living in Rwanda for 8 years, Myal developed World Relief's innovative church-based programming model that's currently in use in 9 countries. He spent 6 years in leadership roles within the International Programs Division at World Relief. Myal has previous experience working with the U.S. government. He holds a Bachelor of Science in Finance from Lehigh University and a master's from Fuller Theological Seminary in Global Leadership. He and his wife Sharon have 3 children. And our final panelist today is going to be Porter Delaney. He founded the Kyle House Group in 2010 after more than a decade of senior level work in the policy and international relations spheres. Porter has substantial experience working on global development and health issues, having represented several high-profile foundations, NGOs, coalitions, and celebrities. Over the last 20 years, Porter has been a chief architect of lobbying and advocacy campaigns that resulted in multi-million-dollar funding increases for U.S. development assistance programs and the bipartisan passage and signing into law of major development legislation on a broad range of issues, including global health security, HIV, malaria, vaccines, nutrition, conservation, and development finance. Porter has advised a number of Fortune 500 companies on their corporate responsibility initiatives around the globe. It's such an honor to have all of you here. I'm really looking forward to hearing from you. Jenny, it's wonderful to see you again today. Over to you, please, to moderate the panel.
Thank you, Lanre. I'm so thrilled to be here today with some of my favorite people in the world. I've had the honor of working with each of these panelists for the last 25 years or so in some capacity or another. And these folks have been on the front lines of creating legislation, strategy, implementation, and advocacy to champion the greatest global health initiatives in the world and in history. Our generation will be remembered for these epic strides to end preventable, treatable disease and extreme poverty. So first, I want to turn to Senator Dr. Bill Frist. Senator, we met when you had just become the Senate Majority Leader in the Bush administration in about 2003, maybe a little bit before then, and you were shaping and pushing through what became PEPFAR. Will you share with us what PEPFAR has meant to you since its inception, now saving the lives of more than 26 million people, and in conjunction with other global health programs? Why is it important to see this through to the end in the fight to end AIDS?
Jenny, great, thank you, and it's a real pleasure to be with everybody today. A little bit of history. When I think about PEPFAR, I really don't begin with the legislation itself. I begin with FACES. In the early 1990s or late 1990s and early 2000s, more than 3 million people were dying each year from HIV/AIDS. Literally, entire communities in sub-Saharan Africa were being hollowed out, and hospitals were filled, yes, with the elderly, but more remarkably, in many ways, with young mothers and fathers, literally in the prime of their life. And children were just raising children. as a physician, I treated AIDS patients in the United States, but when I traveled to Africa, what I saw was totally different. It was different in scale, it was different in suffering, in urgency. I would walk into these rural clinics where medicines, if they were at all, were scarce, and hope was even more rare. Yet trust in American doctors and nurses was deep. At the time, I would see warring fractions or factions pause their fighting so that treatment could be delivered, and even for a few sacred hours, healing would replace violence. And all of those moments stuck with me and stayed with me. At the time in the Senate, I was the only physician. And the only senator clearly who had repeatedly delivered medical care in sub-Saharan Africa. So I knew the science, and we had just developed these effective antiretroviral therapies. We understood how to prevent transmission, but what we lacked was not knowledge. It was, and again, this was 25 years ago, was the political will, and we lacked the scale. And so what was really neat about the time is that we began building it. In the Senate, I had the opportunity to work across the aisle, starting with budget amendments to increase funding for the global AIDS fight. And this was early on. Senator John Kerry, a Democrat, I was a Republican, we partnered to pass a budget resolution that doubled funding for HIV/AIDS programs at the time. And then it was still controversial in many ways. HIV still carried a stigma. Some questioned whether America should stand up and lead it all. And then came the pivotal moment that we've mentioned. President George W. Bush, guided by his own deep personal faith and a belief that we are called to care for the hurting and the widows and the orphans and the underserved, asked Dr. Tony Fauci a simple question. Could the United States truly make a difference? Um, he sent, or Dr. Fauci traveled to Africa, saw the crisis firsthand, looked back at the resources of the United States, what we could do if we did come together, and returned convinced that we could. Mark will be speaking here shortly, but there were a few of us, really a pretty small group, who knew the president would announce this bold initiative in his 2003 State of the Union address. I remember it vividly. It was towards the end. But when he did, he committed $15 billion over a 5-year period to combat HIV, AIDS, tuberculosis, and malaria. And at that time, an unprecedented pledge. Then, as majority leader, once announced, my responsibility was to get it passed and to get it passed as soon as possible. And then the story is really pretty cool overall. It was pretty extraordinary. It was not simply legislation, but it really became a moral coalition. Um, Jenny mentioned Bono, or Bono was mentioned at that time, well known globally, of course, with you two. And we met around 1998, 99, doing some debt relief. But then we toured Uganda together. We visited clinics, listened to families. Jenny will remember it on World AIDS Day in 2002. He launched the Heart of America tour, and calling on Americans, not just people on the coast and people you might expect to be on board, but calling Americans across the country to lead in reversing the epidemic. Franklin Graham, a great friend and a friend to many of you, mobilized faith communities, and he had a sort of a really important role in helping Senator Jesse Helms see this moral imperative of responding to HIV/AIDS, and they prayed together. And Senator Helms, interestingly, who had long opposed international AIDS funding, and he was an icon, a conservative icon at the time. Everybody listened to him, but he had opposed international AIDS funding, but then he experienced a genuine change of heart. And he wrote a fantastic article in the Washington Post specifically saying this turn of events in his mind that we cannot turn away when we see our fellow humankind in need. And that moral clarity unlocked this bipartisan support. And on May 16th, 2003, in record time in many ways, the Senate passed what became known as PEPFAR, the President's Emergency Plan for AIDS Relief. The House had passed it 375 to 41. Bipartisan people had come together But in many ways, it did take the community, the faith community, to make this big pivot. And it does remain the largest commitment any president has ever made to combat a single virus, a single disease. Obviously, COVID has changed that to some extent, but this single commitment up front. The results are historic. AIDS-related deaths globally have fallen by 74%. The 26 million lives saved is real. These are real lives, 26 million mothers and fathers and sons and daughters and teachers and farmers, all alive today because treatment reached them. But the big thing is that PEPFAR did so much more than save lives. It strengthened the infrastructure of health systems. It improved maternal care and child health and laboratory capacity and data infrastructure. It improved these systems. Worker productivity increased, economic stability increased. It enhanced our moral leadership abroad, and health and healing became a bridge to partnership. And as I saw on my repeated trips, a means to peace. So when I go back to Africa now and I meet young adults who are alive and families alive because of this health infrastructure funded through PEPFAR, because of the antiretroviral viral therapy, because of prevention, I'm reminded that this was really just never abstract policy, but profoundly human. The story's not finished. HIV/AIDS remains an epidemic in parts of the world, as we all know. The science has gotten even stronger. Treatment not only saves lives, it prevents transmission. We have prevention tools that have become more sophisticated, and data systems are smarter. So the question is no longer, can we end the epidemic status? It really is, will we sustain the political will to finish the job that we started now 25 years ago? 3 million deaths per year once felt impossible. It felt insurmountable to address. Today, ending the epidemic status by 2030 is within reach. But progress can stall, and as we know, attention can drift, and funding can erode, and viruses in the meantime just don't wait. And if we learned anything in these early days of HIV, it is that silence and hesitation cost lives. If we learn anything from PEPFAR itself, it is that courageous leadership saves them. And for me, PEPFAR does represent America at its best. The science, the compassion, the coming together across party lines. And because we did choose to act now, 25 years ago, 26 million people are alive today. And now we carry this responsibility we're talking about today to ensure that this next generation grows up in a world where AIDS is history and not destiny. And we've just come way, way too far to turn back at all now. So now, and that's the subject of what we're talking about today, let's finish what we started. Thank you.
Thank you, Senator Frist. Kay, you have been a steadfast supporter and advocate to fight AIDS in Africa and support global health since the very beginning. You've led the church in the fight against AIDS since that time, in the decades since, hosting annual conferences at Saddleback Church to promote awareness and dialogue about this most important issue. Tell us the story of where the church has come from and how have they supported these issues, and then speak to where you think the church is today on this issue and how can we do more.
Thank you so much. I was a latecomer to the fight against HIV and AIDS. In 2002, I was a typical white suburban soccer mom with a minivan. I had 3 kids, a dog, busy life as a pastor's wife in a church in Orange County. I mean, we had heartaches and struggles like everybody else, but generally life was good. Life was comfortable. And life as I knew it blew up one day when I read a magazine article on AIDS in Africa. And honestly, at that point in time, I didn't care, didn't know anything. But I saw these pictures of skeletal people, and the words in the article said that 15 million people had died of AIDS in Africa at that time. And there were 12 million children orphaned on the African continent due to AIDS. And I didn't know anybody who was HIV positive. I didn't know a single orphan. And I remember being completely shocked and thinking, how can a crisis of this magnitude be happening right under my nose? And I don't know a thing about it. I didn't have a clue as to what to do. Like I said, I mean, I was a home ec major, for Pete's sake. What did I know about a medical illness or orphans? But I couldn't walk away from what I had seen, and it changed the trajectory of my life. My interest in HIV became known, and I was invited to when the president announced this PEPFAR in 2003, and I was thrilled, but still completely clueless as to what I could do. And then I was invited by both World Relief and World Vision to come to Africa and see what was happening in the work on the ground there. So in 2003, I went with World Relief to Mozambique, and in just 6 weeks later, I went to Malawi in South Africa for the first time. And it was there that it became clearer to me what my role could be and how God could use me to call the church. Because in Mozambique, I met Flora, the first of hundreds of women who said this devastating phrase to me. She said, "What will happen to my children when I die? No one will take them when they know that I died of AIDS." And then a few days later, I met Joanna, a woman who was dying, days away from dying, homeless, living under a tree. She had been burned out of 2 villages, and she crawled over on her hands and knees to sit on a piece of plastic to welcome me. She's welcoming me, a dying woman under a tree. And I thought to myself, what does the gospel, what does the good news have to say in the face of such suffering? Because I was completely unprepared and had nothing. I just watched Debbie Dortzbach from World Relief, who became a mentor. As she sat with this woman, I learned the value of being with, of suffering with, of presence. And I saw the beauty of the pastors in the local churches who were ministering there to Joanna and her family. And I came home completely activated, completely alive, determined to call the church to engagement, even if I didn't know what all that meant. I just knew that we had a voice that needed to be lifted in support of the suffering that I saw. Advocacy, prayer, support, advocacy for drug research, for policy changes, advocacy for making orphans not better orphans, but making them sons and daughters. I believed that the church had a mission and there could be no excuses. I learned in Rwanda, where we spent 20 years, because the president of Rwanda invited us to come and partner with them, with the government, with businesses, with faith leaders, to work with the churches to call them to care for people with HIV, around poverty, around orphans. And over those years, we saw the orphanages in Rwanda, due to the partnership, empty the orphanages so that the orphans in all across the country were adopted. We saw the training of lay healthcare leaders to dispense primary care and HIV treatment through the churches. We saw what we call the 3-legged stool in action. I'm talking really fast. I'm really passionate, and I really care about this, and I get really emotional. So I hope you can make sense of my words. But the 3-legged stool, the partnership between government and the private sector, business and the faith community, could accomplish things that neither or none could do by themselves. That the government can't do it all. The business community, medical community can't do it all. The church can't do it all. But when we leverage what each brings to the fight, traction happens, change happens. And I saw through these years the combined efforts of PEPFAR and the Global Fund, business community, science, faith community, has led to, as Senator Frist said, millions of lives being saved, people living with HIV instead of dying of AIDS. We see children growing up in intact families, and it sort of feels miraculous, but it really isn't a miracle as much as it is just a reflection of what can happen when all sectors of society across nations work together with the power of unified action on behalf of people in need. And I'm going to close very quickly, and I have to say this. I think, I'm going to be really frank, I think putting America first is harming people, is harming vulnerable brothers and sisters, and causing us to focus on ourselves in ways that do not reflect the teaching of Jesus. I believe that legislators and politicians, including the president, are seeking earthly power for themselves and stirring the long-standing pot of racism in the most vile and abhorrent ways rather than seeking to find healing and justice and demonstrating an almost complete lack of compassion for the suffering of others. And the most distressing part of that to me is that many in the church have either endorsed, defended, enabled, and even joined in such contact, or they are sitting quietly in the pews, hoping that maybe they'll wake up and this is just a nightmare, but the church is losing its salt. It's losing its tang. It's losing its ability to influence society. And when salt doesn't have any flavor, it becomes worthless. And meanwhile, that causes life-saving work around the globe to be delayed, disrupted, halted indefinitely, or abandoned as global programs are eviscerated. People will die. People are dying. The church needs to return to its prophetic role of speaking truth to power, to boldly tell our president and Congress that America First is a repudiation of some of the best days in our recent histories, days when we believed the godly principles of being blessed to be a blessing, the principle that when much has been given, much is required. Jesus did not say, do unto others before they do unto you. He said, do unto others what you want them to do to you. The Apostle Paul said, think of others as more important than yourself. Live a life of love. Jesus said, when you visit those in prison, when you feed the hungry, when you give a cup of cold water, you're doing it to me. And when you don't, you're not doing it to me. This is Ash Wednesday. This is the day of repentance. What if we as the church came back, decided that no matter what happens, what anybody else does, we have a mission, we have a calling to be engaged. It doesn't really matter. There are 2.2 plus, I'll get it here in a minute, 2 billion plus people in the world who call themselves Christians. What if we return to our prophetic call? We know what we're supposed to do. Micah 6:8, he has shown you. What does the Lord require of you? To act justly, to love mercy, and to walk humbly with your God. May the Lord bless and keep us as we serve the least of these in his name.
Thank you, Kay. Amen to that. Thank you for that. Myal, World Relief has a long history of partnering with local churches to deliver health and humanitarian impact. In a moment when U.S. global health priorities are shifting, what is uniquely possible when Christian humanitarian organizations work through and alongside the local church? Can you share one example of how this church-based model enables trust, access, and sustained health outcomes in fragile contexts?
Thank you. Thank you, Jenny, and thank you, Senator Frist and Kay, for your remarks and strong reminder of really the power of the church in the United States and bringing about the important legislation that became PEPFAR and saved so many lives and had such an impact. And when I think about the question you've asked, Jenny, about the power of the church, I think about so many stories that I've seen of the church in action throughout Africa and other places of the world as it stood up to this devastating and deadly disease. And I think it's because at the end of the day, the church is Christ's commissioned institution to bring restoration to the broken world and to represent him and witness him in that space. And so I was working on Capitol Hill when this legislation was passed, and my heart was captured by this movement. And I left DC and headed to Rwanda a couple years after PEPFAR had passed and began working with World Relief in Rwanda. And World Relief was one of the very first faith-based organizations who were putting to work the things that have been improved in PEPFAR. And, we saw firsthand the need that was there on the ground. And in those early days, ARVs weren't yet widely available. And so really it was still so much of the work that we were doing was focused on prevention, but also on palliative care and equipping and enabling the church to meet people where they were in this moment of dying. And people were dying, as Kay alluded to, as Senator Frist alluded to, and people were dying with profound shame. Families were fractured, communities were turning their backs on the infected. People were facing their final days alone and condemned. But what we saw is the church began to show up differently. And it showed up with the love of Christ to people the rest of the world had written off. And something really remarkable began to happen. We began to see people experiencing restored relationships. People were having restored relationships with God, with their families and with the communities that they lived in. And that restoration was real and it mattered. Um, and the church was also an extraordinary actor in the work to promote prevention and really meaningful prevention that helped to curb the expansion of the virus. And so I know one project that World Relief was a part of in the mid 2000s was the Mobilizing Youth for Life project, which was funded by PEPFAR. And we reached over 1 million youth in Rwanda and another 2 million youth in other countries in Mozambique and Malawi and Kenya to help them with messages focused primarily on abstinence and really what it means to prevent this disease. And it's because the church was at the heart of those messages that was really crucial. And I think, the church is in the community long term. I had a colleague at the time who would say the church has no exit plan. The church will be here long after any government intervention stops and goes away. The church has no exit plan in there. So they're a trusted stakeholder there. The church is also someone who cares and sees the whole person, the physical needs, the emotional needs, the spiritual needs. And so much data shows that when we care for emotions and spirituality and incorporate these things, that there are genuinely better health outcomes in people's lives. And finally, the church makes a difference because the church and faith leaders are trusted in the communities that they work in. And so even amid, tribalism and political divides that you see and socioeconomic differences, the church is this really crucial agent of trust that's there. And so we can see that in prevention, but we also see that in contemporary times today about ARV adherence and continuing for people to take these drugs that have been so crucial in preventing death as a result of this disease. And so just a few years ago, World Relief concluded a project in Malawi where we had been funded through PEPFAR, the SCOPE project, and it had 154 faith networks in it, groups of pastors and other faith leaders, and 281 different faith leaders were part of this. And they reached nearly 700,000 people with HIV prevention messages. But at the heart of that, and the most crucial message that stuck the most was keep taking your ARVs even after prayer. And so when you can hear that message come from a faith leader and engagement around that and integrate that into the thinking, it's truly transformational. And so through that intervention, those faith leaders made 2,000 referrals to health centers for ARVs, and 88% of those referrals actually went to people following it through and getting on the drugs and having that space. And many times the faith leaders were the people who escorted their clients to the health center to get these life-saving drugs. And that's such a incredible contrast to the times that Kay was talking about earlier and those early years of the pandemic. And so what we see is that stigma drops measurably in this space. 5 out of 6 people living with AIDS in the catchment area said that they had received no discrimination from the faith community or faith leaders. And so these are really important outcomes. And what it shows is the power of public-private partnerships with the church and government to make an end, to save lives, and to see true transformation happening. And what we're seeing right now is as there's been reductions to global health funding around the world, that some of these partnerships aren't possible to go forward. And the church is an incredible change agent in these local communities in Africa, but it can't do it alone. And what we're seeing is when health centers don't have resources, don't have access to drug, don't have materials, it does not matter if a faith leader is convincing people to get on these drugs and get on these resources if they're not in the health centers and they're not available to people. And that's what we're seeing. People are dying because of the changes that we've seen in foreign policy. And it's so crucial and it's so important that we continue to live into this commitment that was made 2 decades ago and continues to have a long lasting and important impact. So thank you.
Thank you, Myal. Ambassador Dybel, as the former leader of PEPFAR during the Bush administration, you've led our nation to achieving efficient and effective results. beyond our greatest hopes in the early 2000s. As the Trump administration has reshaped our foreign assistance to distill the programs now through the State Department and its new America First Global Health Strategy, what positive outcomes might we see ahead, but also what limitations might create some obstacles in the path to achieve our goals to end infectious disease epidemics, hunger, or maternal and child mortality? You're on mute, Ambassador.
Sorry. It's kind of the most common line ever. You're on mute. Um, Thank you for including me in this panel. It's very humbling to be on it with so many of my heroes and also the heroes who are listening. Really, the results Senator Frist talked about are only possible because of the deep commitment and engagement of the faith community. And I've seen that in real life, and I'll come back to it. It's also very meaningful to be having this conversation today because, as you pointed out, we're at an inflection point. And as Kate pointed out, in my faith tradition, today is Ash Wednesday, which is when we are called to return to God, to repent and return to God, but as a march towards the crucifixion and the resurrection, and really a march towards understanding, therefore, suffering, but also faith, hope, and love as that can come in that suffering, and that in the end all is for good and everything will prosper us and not harm us. Sometimes it's not easy to see that second part. And today is a very appropriate time to be called to look for it. I actually want to begin on a very positive note because I think while you can definitely argue with how it was done, if you talk to most African governments and even many African faith communities, the direction that is being taken is the one that they've been wanting for 25 years. They've been telling us for 25 years, these are our countries, these are our people, including the faith leaders. We have the agency. And unfortunately, we've not given them the agency. We've held on to the agency. They've done extraordinary work. We've funded it, but we have not handed the agency to them. And they very much wanted that. So I've been spending a lot of time in countries in the last 6 months, working closely with them on their transition and how they'll do it. And the excitement is really palpable in the countries that they have now the opportunity to really lead and direct a much more effective approach to health, one that captures the whole person, which is what they want to do in the faith community and in the governments, which is something Myal talked about. In my tradition, we call it cura personalis, the whole person. And that is what the faith community does. So there's a real opportunity here. I was recently in Kenya. I met, as I always do, with the combined faith community, which includes all of the Christian faiths, but also Muslim groups, because Kenya has a large Muslim population that have been delivering services with PEPFAR, with Global Fund, with other resources, and with resources they raise on their own, demonstrating in such extraordinary way. I mean, they also provide a big chunk of the procurement of antiretrovirals and antimalarials and antihypertensives because they care for the whole person for the country. They provide 40% of the healthcare in Kenya. They actually found 30% efficiency immediately within 6 months, 30% reduction in their budgets by just rationalizing things. We've loaded them with so many programs and so many requirements and so many things that if they were freed from, they could actually be far more efficient. And they pointed out to me that that 30% reduction was a range between 20 and 40%. I figured the 40% had done the really tough work and that the 20%ers could learn from them. It was the other way around. The 20% had already fully integrated services and had much better outcomes in HIV, TB, malaria, maternal and child health, education across the board. So they had actually less efficiency to find, but there's still so much more efficiency if we get a lot of the systems we have built, the requirements, the regulations that many of you are familiar with because you've suffered under them. If we remove those, the opportunity is really strongly there. And they are excited about what the future can hold and their opportunity to actually get rid of all of the siloing that we have required of them in our development programs, and truly have that cura personalis, truly care for people. The real challenge and what we will all need to work very hard on. And the second bright spot to me is the governments and the countries are now waking up to that contribution of the faith community. I'm spending a lot of time with governments who were not aware of that. Astoundingly, they really just focused on the public health services because that's what they were charged with delivering. They knew things were out there, but they really weren't focused on it. The State Department has now provided, and the Global Fund have now provided the countries with every penny that has gone to the countries, to whom it went, for what, where, and actually breakdowns of those budgets. So they now see what the faith community has been doing on paper, and they're actually going out and learning and understanding what the faith community is doing. The challenge, those are the two very bright light spots to me. The faith community is there and ready to take on the challenge, and the faith community, the governments are now recognizing the need to engage in the faith community. The problem, and this is what we need to work on during this transition period, is most governments, the vast majority, have no mechanism to directly fund faith and community-based organizations. They don't even know how to talk with them because they don't have any mechanisms to meet with them. And we used to do this in the Global Fund, in Latin America and other places. It takes a year and a half, to just begin with supporting governments so that they understand how to meet with and talk with the faith community in certain ways, and have a formalized process to do that. And the second is many of them are going to have to change their laws and regulations. They're going to have to do it quickly so they can directly fund organizations. And by bringing countries together as a community of practice and bring faith communities together as a community of practice across these countries, that can happen. Rwanda directly funds faith-based organizations, as Kay well knows from the amazing work that she has done there. Namibia directly funds faith-based organizations, but most countries don't because they've seen the good work. And so we have the opportunity to facilitate that and actually, in a sense, strengthen the capacity of the faith community to deliver services, strengthen their role in the national service delivery that has kind of been left to the side before. And so there's huge opportunity here, but there's also great risk that we won't move fast enough, that people will claw back to where we were, or try to, because we're never going back to where we were, nor should we, and that we fail in this moment. And so this reminds me very much of 2000 that Senator Frist spoke so eloquently about. We're at one of those moments where we have the ability to see a bright future, to see the suffering, but also the beauty and hope, faith and love that are before us, and to prosper all for good. And if we do it together, as we did in 2000, we can do it again.
Thank you, Ambassador. And finally, Porter, you've been working in the space of global health for almost 25 years now, and global health doesn't look like it did when we first began working together in 2001, like Ambassador Dybel and Senator Frist have spoken about. The Trump administration has radically reshaped our foreign assistance. So talk to us more about the America First Global Health Strategy and what the church can do to help shape that strategy.
Thanks, Jenny, and just echo the other panelists, honored to be with this group, and thanks to the audience for taking the time to participate. I'm going to be brief, just a couple of minutes, and I'm just going to cover two pieces. So one, maybe just flesh out a little bit more, like what is the structure of the America First Global Health Strategy, just to appreciate what is this new paradigm, and then two, what are some opportunities to engage and help ensure its success, as Mark was talking about. So in the structure of it, this really is a very different paradigm of working in 5-year compacts, mutually accountable, bilateral agreements with, we were in about 75 countries. This moves to 50 countries. 15 of those 50 represent 85% of U.S. global health assistance historically. Those 15 compacts have already been negotiated, those MOUs. So they're moving at a lightning pace to negotiate these multi-year commitments where both countries commit resources, agree on sort of the health priorities, agree on the metrics. But that's been happening, they just launched this at the end of last September. And by the end of December, middle of January, they had the first dozen to 15 of these done. And the big question associated with that is what level of resources will flow through these bilateral agreements? How quickly will the U.S. government seek to transition financial responsibility to partner countries? And I just say outside of these MOUs, which is the core of the America First Global Health Strategy, there also are some other structures to try to increase innovation. So an innovation fund is created. They have some funds there today to sort of provide more support to countries as needed. So they have a incentive fund for high performing partner countries to access more resources. And they have essentially like a rainy day fund if things are going wrong to draw on. But the resources that the Trump administration is planning for are significantly less than what the US government has spent in global health over the last 10 years. So we're talking about going from 10 billion to maybe 6 billion. And of course, that creates a lot of potential risk. If the transition goes too quickly with these partner countries, would we see service interruptions? Would we see lives lost? And I think what you would find if you had the chance to go meet with those who are leading these efforts in the State Department and the Global Health Security and Diplomacy Bureau, none of them, of course, want that. These are folks who have decades of medical and government experience who are trying their best to achieve this strategy, but to move at lightning speed. And their own capacity has been decimated. We used to have 1,000 professionals who were doing global health at USAID. Now you have about 75 at the State Department. Maybe 1,000 was bloated. Maybe it wasn't the most efficient approach, but there are real gaps. So I think bringing capacity and partnership to the State Department, to the U.S. government, to help fill some of those gaps, to manage this strategy, to help them think creatively about how to transition financial responsibility with partner countries. And then lastly, I'll just say, because I focus mainly on the Trump administration, because I think there needs to be much more engagement from American constituencies and particularly the faith community, given everything we've heard today about the leadership that the faith community exhibited to achieve these global health successes historic over the last 20 years. It's been a largely insular process. And so I think more engagements and opening doors to have dialogue engagement is super helpful within the executive branch. But then also, with the Congress, where there's been this longstanding great relationship with the faith community, the resource decisions will still get made there. There are opportunities to direct those resources in ways to try to mitigate some of the risk of a fast-moving financial transition with countries. And so I think, as has always been the case, it's both Congress and it's the executive branch, but lots of opportunities to lean in to partner with those who've been tasked with this incredibly fast-moving, ambitious, and challenging paradigm shift. But I would absolutely agree with what Ambassador Dybel said. This is the direction I believe U.S. foreign assistance should go on. That agency should shift to the partner countries. They don't want to be dependent upon foreign aid, but you need a very thoughtful and patient strategy to achieve that transition. And that's where I think the advocacy can be most helpful, is to make sure this transition timeline and the mechanics are designed for success.
Thank you, Porter. So now we're going to transition to a Q&A and answer some questions. So panelist Lanre is going to designate for each of you a question we've seen come through the chat, and I'm going to turn this portion back over to her. Thank you again. I'm so honored that all of you are here today and proud to be a part. Thanks.
Thank you again to the panelists, and thanks, Jenny, for moderating. I have a question. I'm going to direct it first to Senator Frist, and then I'm going to ask others if you'd like to comment on this. In the Q&A, we have a couple of questions around some of the criticisms of PEPFAR or of U.S. government intervention. I'm wondering, what would you suggest to church leaders as they're trying to communicate support for global health priorities? What specific messages help to keep global health support bipartisan, and how can church leaders communicate their strong support for the things that we're talking about here today?
Thank you, and really appreciate the questions. And we've spent today a fair amount of time on the history, and I think that's important because from a policy standpoint, the people who are going to be dictating the policy, for the most part, especially the legislators, in terms of future legislation and funding, most of them were not around. Most of them were not around as we saw the huge successes of a program that was so big at the time that we didn't know exactly how to design it, but we gave it our best shot. And the fact that we can save 26 million lives and 74% reduction in all of the data that's there is a lot. I think what Mark and Porter pointed out is that it was pitch perfect for the time, in the sense it's the best a policymaker could do. It had the demonstrated outcomes and impact, or that we projected, or that we wanted. Some were aspirational, but it worked, and it worked beautifully well as policy can work at a global scale like that. But the time has come to modernize it. built on that infrastructure that is there, built on the systems that are there, built on the dignity of self-determination, of working together as true partners. And that's why this new phase has come in. The messaging is today, it depends on really who the audience is, but it's all demonstrated there from the past. You can just pick back the past. So it's a safety and security for individuals, for their family, and a dignity message. It is a pure health message. I'm a doctor, so a lot of times I begin with that. People who have greater well-being become more productive. They show up for their jobs. Civic society is no longer hollowed out. It's an economic message of prosperity. If we've gone back and looked at the countries that we've invested in the past, those are the very countries that have grown the fastest in terms of job creation, in terms of their own GDP, again, showing that relationship between health. And then lastly, it's a national security issue. When you're not hollowing out the very best of societies today, but you're lifting them up, making them more hopeful and more productive, you create a society that is stronger from a national security standpoint. So each of those are platforms that we can look to the past on, and we can call upon, and then package them appropriately for the future.
Thank you, Senator. Would any other panelists have something to add to that? All right, while they're thinking about that, I do have another question, and maybe Ambassador, I'll ask you to first opine on this one. You've talked a lot about what local governments are picking up in the America First Global Health Strategy and kind of the posture of the administration towards global health. Where do you see that church investment is needed? You talked a little bit about faith investment, but where would you see like an American church getting involved in these issues? Or is there a place for the church, and what would you suggest?
It's a great question, and it all goes back to where things began, as Senator Frist and Kay and everyone's spoken about. The faith community was so essential to the success of PEPFAR, and has a fundamental role in this moment, particularly to support the faith networks that are there as they move through this transition. Financially or any other way. A lot of the faith-based communities have, in fact, been raising substantial sums of money to help backfill gaps that might have occurred, and particularly if governments don't fund them directly. And some won't. The reality is some governments, and we saw this in South Africa, for example, when they have the choice, we'll just move everything to the public health sector. And so the second thing is to be there to support the churches and with the US government and others to make sure the governments understand the risk that they take by not engaging with the faith community, because the services are much better. That's why Rwanda and Namibia and others did it. And directly fund the faith community because they go to the churches, they go to the hospitals, they go to the care centers, and they see the great work that's done, so they fund them. And we need to sensitize and educate governments to that fact because they don't see it naturally. And that community practice I talked about, having churches from across countries engage with each other, learn from each other so that they can share with their sisters and brothers in different faith communities around the countries, that helps them be able to advocate and push. But we're all going to have this next 12 to 18 months are really critical to laying the foundations for the transitions. The budgets are actually quite good for the first year and a half, even two. It's then that they start coming down a lot as countries are expected to take up more and more over time. And so if those building blocks aren't there, things could start to fall apart, as Porter was talking about. And really, this is the time to support the faith communities to make sure they have the resources that they need, but also that they have the tools to advocate in their own country for laws to be changed for direct funding. They can be very powerful in that advocacy. But also with our own government, not advocate. The administration completely understands this. And the fact that they gave the lists to the countries so that they could see how much money was going to faith and community-based organizations is a great demonstration of that. And the Global Fund's done the same. But we need to make sure that it continues, especially as different people transition. So I think in all those ways, the faith community has a pivotal role as it did in the beginning. To be honest, we've lost a lot of the engagement of the faith community, and that might be part of the reason we're in the position we're in. So now's the time to come back.
Thank you. Kay, I'm going to ask you our last question for this panel today. You've spoken very passionately about your work and the experience that has borne your advocacy in this moment. I think a lot of people are looking at the state of the world and feeling a lot of overwhelm. Can you give us a sense of where do you draw strength to continue this advocacy work that you do? How do you continue to show up in this space?
Um, Pardon me. Thank you. Thank you so much. For me, it is, I have learned through going through our darkest days of losing our son to suicide in 2013, which actually was the catalyst for my advocacy moving from HIV, AIDS, and orphans to mental health. I have walked through my own darkest days, and I have a different understanding of suffering, and that has drawn me into fellowship of the sufferings with Christ. And that is, to me personally, the place where I go back for hope. Because honestly, sometimes it feels like the world is going to hell in a handbasket fast. And on those days when it would be just easier to retreat, just turn off the news, just not pay attention to what's happening in the world, just focus on myself, my own family, that it is that call back to making the suffering personal. I think that it is human nature to try to keep suffering at arm's length. We don't like it. It's too painful. It's too hard. None of us want it. And so when we're suffering in our own lives and then we hear stories of other people suffering, it's just really easy to turn the volume down. Just turn off the TV, turn off the news, turn off the internet, and just focus on ourselves. And I think that for me, the way that I stay engaged truly is coming back to that place of who is it that I serve? I serve a God of compassion, the God of all compassion. And he has asked me to be part of making the invisible God visible in this world. And the only way to do that is to engage with my own suffering, to engage with the suffering of other people, to engage with the God who loves passionately every person he's ever made. And so for me, it is really connected to my own intimacy with God, my own walk with him. And from there, that moves outward. And anytime I want to just pull it all within and not be engaged and not have hope that God is still at work in this world, those are those moments I go back in prayer, reconnect with the God of all compassion, and then ask that he move me forward in calling other people to also engage with him first and then with each other.
Thank you so much. That's all the time that we have for our Q&A. I'm going to move us into the last bit here. Thank you so much for joining us. We will be sending a recording of this call to all of you who have registered so that you can continue to share it and pass it along to folks in your network. As we close, I want to share a couple practical ways that you can continue to engage on this topic. And so the first way is to give. As discussed, the shifts in our foreign assistance and global health strategy require the church to step up and to care for the world's most vulnerable. We implore you to join World Relief to implement life-saving health services around the globe during this critical time. A second way is for you to advocate. We invite you to join us in advocacy. Ask Congress to support robust funding for global health, PEPFAR, Gavi, the Global Fund. Use your voice to engage the White House and the State Department to support sustained global health leadership and to ensure the implementation of the America First Global Health Strategy does not result in the interruption of life-saving services. We have an advocacy tool that we make available to you in the chat here that you can use to do that. And also pray for those that are living around the world, living in fragility. Pray for the current U.S. administration to lead with wisdom and compassion, to choose to sustain foreign assistance for the good of the world and the American people, and pray for the church to stand in the gap and care for those facing crisis during this critical time. I'm going to close us in a word of prayer. God of compassion and healing, as we conclude this conversation, we remember every mother, father, and child whose health and hope hang in the balance. As policies shift and priorities are debated, anchor us in your unchanging call to love our neighbors. guard hard-won progress against preventable disease, strengthen clinicians, community health workers, and the local church that serve long after headlines fade, grant wisdom to those in authority here and around the world so that decisions are just, effective, and merciful. Stir your church to be present, truthful, and tender in every community, bringing trust, access, and sustained care. Send us out with courage to act together so that hope becomes tangible and health is restored. Amen.